There's a word we use for children and then kind of forget about: wonder. Like it's something you graduate out of. But I've met too many people who never did: scientists, artists, pastors, nurses, potters, people who went deep into something and found that the deeper they went, the more there was to wonder at. Turns out, wonder never stopped. We just stopped paying attention. I'm Keats Miles-Wallace. This is Over the Moon. Prepare to be slightly undone. Hey y'all, this is Keats Miles-Wallace with Over the Moon, and today I have the pleasure of sitting down with Dr. Linda Sullivan. Linda, will you introduce yourself, please?
Yeah, I'm a family doctor and a former cellist and a mom and a wife, and a just explorer of all things that bring joy.
Excellent. So how did you end up being a doctor and also a cellist? How did you get here?
Well, I started off really involved in music, and over the years, you know, never had any doubt that that's what I would do, but I always had other things I was interested in. In college, I really didn't take any science classes, but I kept feeling this tugging at me that I wanted to be involved in medicine in some way. I wasn't sure whether that meant nurse practitioner or physician, maybe researcher. I wasn't sure, but I met a wonderful cellist named Peter Raito, who was touring and had a wonderful solo career. And we had some conversations about what was coming ahead for me, because I was an undergrad at the time and trying to decide about graduate school. And I decided, after talking with him, that now was the time to keep going with music, because it's sort of like athletics, right? You're at your prime once, and after that, you can take some time off, but you're never going to be you're never going to be where you are, after you've finished graduate training and are out playing professionally. I felt I just had to, kind of scratch that itch, and so I did. I went to graduate school at the University of Texas at Austin. That's how I came to Texas from Oklahoma originally, and finished my master's and played professionally for about 8 years. And then one day I was playing in a living Christmas tree, of all things, and while I had had wonderful experiences, right, and played incredible music, I had, I was sort of taking every gig I could to survive. And living in Austin, prices were, rent was going up, and um, everything was
Right.
expensive, and I didn't have health insurance and all those things. So I was playing everything I could get my hands on, and I had traveled like 45 minutes for this gig. And so it's like an hour and a half round trip. And it was just, I just saw myself sitting there playing, and these little heads were bobbing in the living Christmas tree, and we were changing keys every 5 bars, and it was just, I was just like, this is really not what I had in mind. It's fine, and I was grateful to play, but I thought, this is becoming a chore. And while I love it, I don't want to ever stop loving it. And so I made the decision at that time to just take class, getting ready for pre-med. And then that led to another class and another class. And then found myself finished my prerequisites at UT Austin and started to apply. And here we are. So I've kept up my cello a little bit here and there, but not nearly enough. So it's one of my goals for the near future, is to get it out again.
That's awesome. I can imagine that both music and trying to find your way back to it and medicine, being what it is in the United States today, are not necessarily the easiest things in the whole wide world.
Yeah.
Um, what are the beautiful things that keep you coming back and just keep taking your breath away?
Well, I think in medicine, and I'm family medicine, so I'm the first stop. Um, I think there are these moments where I have gotten to know a patient well. We've worked through some problems, and there is just occasionally, and it doesn't happen. A lot of it is just the what we all do, right? It's just the slogging through and doing the refills and doing the prior auths, and um, but sometimes there's this personal connection that just really makes me pause, kind of makes both of us pause, and it might not be expected at all. Sometimes a question will lead to another question, and then we find ourselves, talking about something in their past, or something they hope for the future, and we're out of the we're out of the realm of prescriptions and orders and treatments, and into the realm of just being two human beings together. And I think those are
Right.
probably some of the most satisfying moments for me, um, is to have that connection. That's what I always wanted. That's why I ultimately chose family medicine, is because I thought, if I'm treating a human being, first of all, I want them awake. So I knew I couldn't do surgery or anesthesia. I want them alive. So
Sure.
I couldn't do pathology. I'm an introvert, and so it's always been really interesting to me. Is it takes a lot of effort for me to talk to people, so I feel like I have to get through and connect in these ways in order to kind of sustain me. And that
Yeah.
happens, that happens frequently in this job, just because of the long-term relationships that you have.
That's, I think, a big part of why I asked if you would do this podcast is because you get to see people over a long arc of time, and it's not, the flashy Grey's Anatomy surgeon
Right.
life.
No.
Um, it's a much more humble version of medicine, I think. Um, but one that does get to see that long arc of a
Yes.
person's life, from uh births to regular everyday care to chronic illness, aging,
Yeah.
death. Um,
Yeah.
what what does that sort of continuity do to or for you over time?
I mean, I think that, first of all, it gets a lot easier to treat people when you walk into a room and you already know. I just changed jobs about 2 years ago, and brought a number of my patients with me from my old office, but then inherited a big group of new patients, and getting to know them all was overwhelming the first year, because I would walk into a room and it was either somebody that I knew previously or is a completely brand new. But either way, I had to get them into a new chart. I had to get everything sorted. So I'm just now getting to the point where, I can do a quick glance at the chart, walk into the room, and ask them how that trip to Spain was, or what, how did surgery go, without really even doing any kind of a deep dive into their chart, because I just know them. I know things about them,
Sure.
and that builds trust with me as well. I mean, it's really scary to go um, into a doctor's office, not just because of, sometimes we're afraid of what we might find, or what might happen. Will it hurt? Is it going to cost a lot of money? But also because we're revealing a really, a lot. It's not just about, um, the mechanics of our health. It's about who we are. And if you don't get to that point with your doctor, I think you're missing out on depth of knowing, that actually can
Right.
influence the quality of your care. So I find that in patients, and some of them are very complicated, patients that I know well, it's so much easier for my brain to do this diagnostic dance that it does, if I know, first of all, who they are as people, what they want from the relationship, what they need, and just have had that you know that time to build up a rapport and a, um, just that history where we've had so many conversations in that room that it flows easily and you can get past that kind of reticence and they start to trust me. And that is a really great place to be, I think, because it makes both of our experiences better, makes me a better doctor, makes them a better patient. Um, and it sustains me. I mean, it does. If it was all just refills and doing labs and um, doing physicals, I think anybody would get burned out. You have to have something. At least I have to have something deeper to keep me going, to fill my gas tank back up. So
Sure, kind of the wonder of that relationship, uh, more so than, well, you're seeing me today and you might see someone else next week, and who
yeah,
knows?
yeah, right, right. Yeah, it's I've developed relationships with patients and over the years that have become really hard to leave. Either when I leave a job or when they move, I really feel like I'm leaving a part of me behind almost because it's part of that whole experience for me of this sort of tapestry of human beings that parade through my office and in all of their
Right.
in all of their complexity and beauty and all of those things. There's always still things that just sort of surprise me and that I wasn't expecting about people that I learn in those longitudinal kind of relationships. So
Are there things that you're comfortable or HIPAA able to describe that are some of those surprising things?
I think that I find out things. I mean, I don't, nothing super specific, but there's some patients we talk about books. I find out that they're a
Mm,
reader and we start sharing, hey, what's the last thing you read? And I see people's sort of walls break down over time. Somebody that might have not made not have made a lot of things really obvious about their history that just would only tell me what I asked, that I find they're sort of opening up gradually over time. Um, and I mean, when you know someone well like that, and you have a great rapport, it feels like you're sitting down to chat and we're doing work, right? But it
right.
just, it flows so easily. Um, and so those are the types of connections I think um, that make it worth all the other stuff for me. And the other stuff is sometimes
Fair
not that fun.
enough.
Yeah.
Right? Like you said, the filling out labs and pre-auths is not fun for anybody.
Yeah. Yeah. It's I'm always also not just in the human connection, but I'm when I think about what has to happen, like that diagnostic process, um, it just sort of blows my mind that human beings can do that. And I'm nothing special. I mean, we all do this in this profession. Um, there's so much, there's so much internet searches and Googling and Chat GPTing, and so often patients will come in and they'll say, "Well, why don't you order this, this, and this?"
Mm,
Or I read that this thing is not good for me, um, and and I'll have to sort of dive in a little bit to, okay, the diagnostic process is more than just this lab, right? I mean, I have to decide from
sure.
this almost like bird's eye level what could potentially be going on. Like, how old is this patient? What are the most likely things given their age, their sex, their demographic? And you put all their symptoms into these categories and you narrow it down, and then at the very end of that, when you have two or three things that it could be, that's when you decide what labs you're going to order. You don't start them from up here, right? um,
Right.
and so while it's sometimes frustrating when people have very specific requests for certain labs that they feel like they need to have done or certain tests or whatever, having to engage with patients in that way and sort of explain what is actually happening in our brains when we make decisions about workups and treatment has been actually really, I think it's been really enlightening for them. And it's been a way to connect for me because they go, okay, I had no idea. I thought you could just order a lab and figure it out. There's so much more, so much more. In fact, if you order the wrong lab, it could send you in the absolute opposite direction from where you need to be diagnostically, right? I mean, if I get distracted by every squirrel and shiny object, and I don't stick to my, my ruling out and ruling in and the process that my brain goes through when we ask all these questions about how long have you had it, what makes it worse or better, what have you tried, like all of those things that we learn as students. If you don't do that every time and you get distracted, either by like what a patient tells you they think it is, which is, by the way, don't ever do that. Unless your doctor gets to the point where they say, what do you think it is? But if you come in and you say, I think I have blah, that puts our brains in this completely different space. And it takes all of that diagnostic arc of things that are picking from in our brain to kind of figure out a plan. And it puts it in a much narrower space, right? So it's been interesting having these conversations with patients about what actually happens when a human being is talking to you and trying to figure out what's wrong with you. Especially when we're talking about AI potentially taking over certain decisions in medicine. I'm sure that AI is probably better than me at some things, and I still look things up every day. There's just no way you can know it all. But to think that we could potentially start to erode that relationship and that process, to me, is really scary. And I hope that we could continue to have conversations like this with patients, because it is really important for people to understand that the human brain is capable of so much more complexity than AI.
Yeah, the human brain is a computer that we cannot fathom the capability of yet, right? Like scientifically, it generates more than we can understand.
Oh, all the time. I mean, I think sometimes about like that gut feeling, and when you trust that, you're almost always heading in the right direction, right? When you ignore it, you go down a path you didn't want to go down. And I wonder sometimes, like, what is that gut? Is that gut from training? Is it from every experience that we've had, right? Is it from just something that we read that we tucked away and that popped back up? Is it how the patient looked? I mean, there's so many things, right? And that's true about other fields too. That gut feeling is infinitely complex and has come from so many different places, right? To create that moment where you go, that's not right. Or, yeah, that's really right, And I think that lots of people experience that. We don't always listen to it as much as we should.
This is a great chance for me to ask if I'm doing doctor-patient relationships right. Is it fair to do kind of a hybrid model and say, cool, I'm going to look up what I want to look up and figure out what I personally think might be going on with me, but let you do your diagnostic process first, and then at the end of where we're at, say, hey, I looked this thing up, and this is what it came up with. Is that off the wall, or is that even in the realm? Is that a fair balance of the two?
I think that's fair, because if you do it, especially at the end, right? There is a
do you have any more questions portion?
Exactly, right. There is an intense bias that comes from patients giving us information, right? And you would think that we would be the ones sort of making the call at all times. This is what this is. But when a patient tells you something, it can be a powerful way to guide how everything is going to go. So, like if you came in and you said, I've been really tired, but I think it's my allergies, or I've had some chest pain lately, but I think it's reflux. Just in that moment of saying that, it changes something about that process, right? However, I think there's really a place for patients, bringing in their own ideas. I'm not certainly not saying that you shouldn't,
Mm.
but I think that especially if it's kind of a complex, like a bunch of different symptoms or something sort of vague like fatigue, I think uh, it can really push things off course if you don't allow that diagnostic process to happen. And in medical school, we're taught this very specific way to do an interview and to figure out the problem, and it's timing and duration and quality, and does the pain radiate anywhere, and what have you tried, and how long, all of those things actually really have an impact on those two or three things that we come up with for diagnosis. But I have had patients who um, have brought me ideas, have looked something up that I wouldn't have considered, and that's helpful. It is. But I think what we have to remember is that the research, patients say, I did my research. What is the quality? Like, where are you getting it?
Right.
I have lots of conversations right now with patients who are really afraid of taking statin drugs. There's a massive amount of research on statin drugs spanning decades that they are beneficial for people who have coronary artery disease, who have known coronary disease. And in spite of that, you'll ask a patient, well, why is it that you didn't want to take this drug? Well, people say really bad things about it. And,
Mm.
and I'll say, okay, well, where are they getting their information? Well, they think that it's related to dementia. And,
Right.
and it's just so interesting to me that I'm sort of up against, right, this hearsay, this sort of internet um, chatter. There's definitely great sources of information for patients, and if they're taking advantage of those and they're really going to the sources and they're going to the um, to the primary research, and they're on PubMed and they're doing all those things, great. But if it's any less than that, um, it's fine to ask questions. It just may not be helpful in the end. But I do take those opportunities to consider, definitely consider other things when patients bring me those. Well, what if it's this? And then we can talk about, well, here's why I think it's not that, because you don't have this, this, and this, and this is much more likely the cause. So let's order this and this, and if those are negative, then we'll keep going down the list.
Right.
Does that make sense?
Yeah, absolutely. And I think it really details again that the diagnostic process is really important.
Yeah,
That there is an etiquette around not disrupting that if at all possible, and that
yeah,
etiquette is beneficial to your health, not just a simple courtesy. Um, and that it's okay to bring up an idea. That it's okay to ask a question and to hold that
absolutely.
information loosely.
Right, right. And I think too that there's this sense that we're just sort of plugging things into a calculator and getting a result. And in fact, everything that I have experienced in my professional career, in my residency, and sometimes just in my life, like, oh, I knew somebody that happened to. All of that can play a part in making those decisions, right? I saw things in residency um, that I knew that I would probably never treat. We were doing procedures and doing things that I knew that as an outpatient family medicine, I wouldn't be doing. But, you walk into a room and you see how sick this person is, and you learn their history, and you learn how they got there. And yes, you're doing the procedure that you're probably not going to do in real life. I haven't put in a chest tube outside of residency, you know,
Sure.
but I will always remember that patient that had that pleural effusion, that had that fluid on their lungs, and why we put that chest tube in. And well, it's because there was this huge fluid buildup. And well, what caused it? Well, in that patient, it was cancer. So I've never since looked at a pleural effusion on a chest x-ray and not thought that cancer could be a possibility, right? But if you don't see that, you know you've read it in a book, but you're much less likely to pull that into your actual, we call a differential diagnosis. I mean, it's the things that we've pulled out of all of this infinite complexity of memory and learning and experience that help us to make that decision. And when you think about a computer doing that, the thing that scares me the most is that my husband has tried to explain AI to me. I still don't think I really understand it, but it's basically it's this mathematical equation, and I know I'm simplifying it. So while it's accurate in many ways, there's no way that it can do these complex decisions that the brain is asked to do in medicine, especially at the diagnosis, at the ground floor where we're at in primary care, and people don't realize how many possibilities there are. Like when you come to the doctor and you say, wait, you've got how many things it could really be. And if you haven't had that experience, you don't have those things to pull into your decision-making process. So computers are only as smart as we make them, right? They only have the information that we feed them. And are they even getting correct information? I mean, I'll use AI in practice, and I always look at the sources where it came from. And there's one specific source that I use that's very, very research driven, and you can look at their citations for every single thing that it says. But even then, you find mistakes.
Right. I think people who have listened to the podcast will hear in episode 1 I described AI a little bit like you're trying to have your grandmother's recipe, but you're getting it from 17 different people. And so as it's aggregating that information, it's not actually your grandmother's recipe anymore. It's an amalgamation of all these different things. And so I think the same thing with medicine, where you don't go to the doctor asking for them to use a shotgun to figure out what's wrong with you. You go to the doctor asking for a specific diagnosis, and AI may be able to give you the shotgun, right?
Yes.
Which WebMD has been able to do forever, and it can tell you that your symptoms equal both a cold and cancer.
Right.
But that's not the same as asking a doctor to actually chase down specific information.
Right. And I find that's such a great analogy. The grandmother's recipe is such a great analogy. But I found that because there's no filtering of information on the internet, right? And we're just amazed at how much time we're spending dealing with healthcare anxiety, which is not a thing when I was training. It was. I trained in Waco, Texas, in a fairly research-rich area, but the percentage of people under the poverty level was significantly higher than it is in most places. And because of that, we saw a lot of different things. And unfortunately, we saw a lot of people that had not had access to healthcare, whose diseases had progressed. And I just remember, even as a resident, I think about what residents know. I mean, fortunately, we have wonderful brains behind us and our attendings and lots of support. But even as a resident, they would come in and they would sit down and I would say something and here's what I think it is. And here's kind of what I think that we should do. And it was, yes, doctor. Okay. When do you want me to come back? And now it's like, you're having these conversations and I find myself, not that I'm always right. And like I said, human bodies are infinitely complex and I'm always willing to look at other possibilities. But, I'm finding myself having conversations sometimes with patients who are asking, well, why wouldn't you do this instead? And again, I get that. And we should explore those things. And it's important for them to be reassured why I don't think that's a good idea, or why I don't think we need an MRI right now, or why I don't think that your headache symptoms are a brain tumor, because you don't have the red flags. If we try other things and we don't get there, then yes, let's get the imaging. But it's just we're spending a lot of time um, uh, in those types of conversations. But there's also just this really really intense level of healthcare anxiety that I think the internet has gifted us. And it's really unfortunate, because I think that we end up ordering more things. I think we end up doing more things because of that, because all of the possibilities, right, are out there without the filter of that human being, physician in front of you, who's had all those years of experience and all of those things that helped them make that decision about what was the next step. But I think people they've also been very um, um, disappointed by healthcare, and they've been disappointed in our system, and the system has failed them. I was thinking about that idea of the system being broken, and this is probably not a very popular uh, opinion, but I really don't think that our system is broken. I think that we can do incredible things for human longevity, for human health, that we have never been able to do. It's so complex to get them done, right? But because they're so complex, it's why it's so hard to get, you know what I'm saying? I mean, there are so many things that make getting the thing done and getting the answer potentially not happen, right? Maybe you didn't have transportation. Maybe the person on the phone got your name wrong and you never got a call back, or they tried to call you and you were blocking your calls, and the test never got ordered. I mean, it goes on and on, right? Um,
Sure.
I really don't think our system is broken. I think that we have leapfrogged forward so fast in what we can do for human health, that it has at once raised expectations, right? Well, why can't you figure this out? Why are you sending me to 3 doctors, right? um, but also, it has raised the complexity of getting all those things done. I mean, I do think the insurance system is broken, for sure. I mean, that's really messed up. There's no doubt there. But is the system that we work within, is it truly non-functional? And I think, well, how many times have you had a really successful interaction, right? That's helped you. And it's really hard for people who have had terrible experiences to understand that. And I'm very sympathetic to that. But when you look at it as a whole and you step back, we're actually doing pretty amazing things.
It's a little like a city that grew too fast, right? And then so you've got
Yeah,
lots of people and amazing things are happening, but the infrastructure just isn't there.
right. Yeah, like Austin, right? Or I spent many years in Austin. I adore Austin. But two main highways that go north south in the city ain't gonna cut it. And even when they built more roads, it's the growth outpaced the infrastructure. And I think that's a great analogy, and I think that's where we're at. I think we have kind of light of what it means to be just okay and you're fine. We worry about things a lot more of what all the possibilities could be, but what we can't see is the forest, right? We can't see overall human beings live many years longer than they used to. You know, um,
Mhm.
I mean, I see people come in their 60s, and I feel kind of silly asking them these Medicare questions about their memory, because they're fine. There's nothing wrong with their
Right.
memory. They're still working, but they have Medicare or whatever. And so I'm expected to do, by the way, I'm actually a big fan of the Medicare annual exam. I think it's got a lot of things in it that are very useful. So I do them all the time. But sometimes you're sitting there and there's a 65-year-old in front of you and I'm going, how many falls have you had? And they're like, I am a marathon runner.
Yeah, right.
Yeah. And I'm a college professor. No, my memory's fine.
Right.
But those questions were developed at a time when 65 was pretty old, right? And now it's I mean, people are working much longer. So when you sit where I sit, it's a lot easier to see the progress and the growth. But on the individual patient level, when you have a negative experience and things don't go right, it does feel like things are broken because you can't see all the successes in this giant human organism that we have. And I have a great deal of sympathy for that. And I do try to do my best to help empower people to understand the process, right? I mean, so many things can happen there that I think it's the level of complexity is really difficult, especially as we get older, to keep up with. But it is those types of things, right? Well, I didn't go see my cardiologist because I didn't know I was supposed to. And then things happened and,
Sure.
So.
Or the insurance said I couldn't, or, whatever.
Yeah. Insurance limitations are frustrating. They really are. But there's ways around those. Like when you look at the whole picture, there's still a lot of options besides the medicine that you see on TV, right? And we all did fine for a long time without all those new medicines. And while it's frustrating for me to get those denials, sometimes it makes me go back and go, okay, wait, did I really need to order that? Like, is that really? And if I did, I mean, I will fight. I will fight for the patient to get those things done. But sometimes it actually does make you go back and go, okay, well, why don't we get this? Maybe we can get the treadmill stress test instead of the nuclear test, and that would be okay for now, and we can move forward if we need to. But yeah, we can't have everything we want. I mean, it's really frustrating to me the amount of money that insurance companies are making. That I think is unethical. But at the same time, we do still have good options for patients, even within that system. As much as I wish it would change, it's possible to make it work.
All right, shifting gears. What's something that the human body does that genuinely surprises you after all this time?
Yeah. I think the ability to come back. I guess the overarching answer would be healing. That's not very specific, right? But I'm still amazed at the body's power to heal when we let it do its thing. I've seen patients who come in with, it's called an ejection fraction. It's how much blood the heart pumps out with each beat, right? It's supposed to be around 55%. And I've seen people come in with a certain type of cardiomyopathy that has reduced their ejection fraction to 10 or 15%. And those people are having to have major interventions and implanted defibrillators and things like that. And I have seen people come back from an ejection fraction of 10 to 15% with literally medication alone and time and doing the right things, come back to having almost a normal heart pump. And to me, that is back up to that ejection fraction of almost normal. To me, that's really incredible that we have, this organ, right, that is so capable.
Right.
And I sort of anthropomorphize organs sometimes. I talk a lot about metabolism as wanting things, and metabolism wants to be the same, and I'm like, just bear with me. I think if the body is this as almost systems as almost having their own personalities, but the heart could just take so much, before it gives up.
Right.
And then once it has given up, it comes back. I was actually thinking about the heart too, and I was sort of thinking about talking to you and thinking about how much crossover there is between emotion and the actual organ of the heart, right? Like, so we talk about, oh, my heart was broken. Well, actually, your heart can be broken. There's a type of heart failure that it's actually caused by intense emotion. And there's nothing else that causes it. These people don't have coronary artery disease. They don't have other things. They don't smoke, but they have heart failure due to intense grief, intense emotion. And that is, to me, all the proof that I need to know that we don't just say, oh, this hurts my heart because it's a colloquialism, or it's part of our culture to say that.
Right.
It actually does, right? It does. And so I think I've always been fascinated with the heart, and that is always a source to me when it heals and people do get better, of just wonder, I'm fascinated by psychiatry, and I get to do a lot of that, and of how much a person can come back to themselves with treatment. And people will ask me, well, how is this medicine going to make me feel? And I'll say, you should just feel normal again. If this works,
Right.
you should not feel any different. It's not going to solve your problems. It's not going to make, your bills disappear. But instead of feeling like you feel now, you will just come back to yourself. And they'll come back, and I'll say, well, how's it going? And how are you feeling? Oh, I don't feel any different. Oh, okay. Well, how are you sleeping? Oh, I'm sleeping great. And they weren't sleeping great before.
Right.
How
The bar for normal changes.
Right. It's like, or they'll just say, I just feel like myself again. And that's when sometimes the tears come too with patients. And
Sure.
when you really see somebody who was so ill, and without surgery, without devices, you're able to bring them back, help them come back into themselves, with medication, with therapy, with all the things. That to me is an incredible gift, and doesn't happen quickly, but when it happens, it just it is one of those magical moments that you go, okay, this has all been worth it.
Right. Similar to the loss of ejection fraction, the loss of self in psychiatry, the whole point of Over the Moon is that wonder is a capacity that we can lose. That the ability to recognize wonder is something we can lose. You seem like someone who is very good at recognizing wonder in your life. But I'm curious, what do your patients teach you about, particularly with wonder, the ability to lose and recover that?
I think that there are some people who have been saddled with so much grief, so many mental and physical challenges, social problems, and then just good old fashioned bad luck. I think those are the folks that amaze me the most, that come in and, they've lost a child or a grandchild. They're struggling financially. They're having all of these health issues, and they really do lose hope. And I think that resilience that hardship teaches us, is kind of where that comes from, right? I think that it's also about expectation, right? So if your expectation is that feeling wonder and hope is going to be like traveling around the moon every time, like you're can be
Right.
sorely disappointed. That does not happen very often. And the human sort of equivalent to that even in our lives at our levels doesn't happen. So we have to lower our expectations, honestly. We have to sort of come back to the very basics of what can sustain me without the fireworks and the huge discoveries and the perfect recoveries that we sometimes see, right, in life and in medicine.
Sure.
What's going to be enough, right? Like, what could be enough to help me keep putting one foot in front of the other? And, you know, we talk about families, we talk about relationships. I'll have conversations with older people who are really isolated. And, they'll have gotten some of their health back through these amazing heart devices, and their color is back, and they're feeling better, but they're isolated and they're lonely and their kids don't call them. And we sort of talk through it, and we find a way to find some joy. Like, we don't drive anymore. Okay, well, could you have a small thing that you do every day that brings you joy? Could you do a puzzle, or make something, or get back into your woodworking or whatever? And to me, that's where we recapture it, right? Is in these very baby steps. Because if you think about how much effort it takes for many people with big challenges just to get through the day, right? They're not going to have these moonshot moments. They're going to have tiny moments that let them have another tiny moment that lets them. And I think that's how we get it back.
Right. Makes great sense. All right. I have two final questions for you. One of them I think you already know because I saw you read my post this morning. What if the men in black were to arrive and say, Linda, so sorry, you saw something you shouldn't have. You've been involved in some alien plot against the universe. We have to erase your memory, but you get to keep one thing. What's your one thing?
I actually see this, right, in patients who have dementia, and essentially their memory is erased. And the most painful thing is not to remember the people you love. So I think, to me, I could forget everything except I would give up all the knowledge that I have and all the memories if I could retain remembering, the people that I love.
That's excellent. All right.
'Cause,
Last
yeah,
question. What are you still wondering about?
I think I'm wondering about where we're going next with technology in both, medicine and in the world. I'm wondering how long we can sustain being so disconnected
That's
from
real.
who we are and where we came from. And, one of the reasons I wanted to sit in this kind of noisy park full of birds and things when I was talking to you is because I thought, well, here I'm going to be able to pull those things from my brain that sustain me, right? Like, after a long day of doing prescription refills, I'll come outside and I'll think, okay, this is where we're moving away from. That's making us so sick. Is we're moving away from conversations, we're moving away from nature, we're moving away from honest, real food that we make ourselves. We're moving away from being slow. And so I do wonder, and I actually have a lot of hope about this, because I see young people pulling away from their phones. I see them reading books and meeting together and not having devices. And that gives me a lot of hope. I wonder about the point at which medicine has become so complex that we're actually doing harm, when our oath is to do no harm, right? That we have become able to do so many things that we're not actually not sustaining health or improving health, that we're actually just creating more complexity. And so I think that is a continual um, goal for me to try to keep it as simple as I can for the situation, to hold on to that humanness, right? And not dive so far into the technology and the answers and the big things that we can do that we lose sight of what actually really needs to happen here. And sometimes it's not a medication or a test. Sometimes it's just you got to listen to somebody's story, um, and
Sure.
build that trust. And from
I want to thank you so much for being willing to do this,
yeah,
um,
my pleasure.
and sharing. I really appreciate one of the questions that I had that I didn't ask, that I don't need to ask because you explained it in your answers, was um, how you kind of, in a profession that is really bent on having an answer, usually specific one, do you how do you train yourself for wonder as well? And I don't know the how, but you've clearly done it. You seem to recognize the wondrous things in the small pieces.
I think that just human beings train you for that, right? Like if you just keep your eyes open and let what you want to say kind of hang in the background for a minute and let your preconceived notions of who you think they're going to be or they are, they will just surprise you every time if you give them space. And I think that's what has helped me sort of hold on to the wonder, is just the allowing human beings to be these miraculous creatures that they are in so many ways.
Amazing. Linda, thank you so much. I'm very, very
Thank
grateful.
you.
I'm sure our listeners will be grateful as well.
That's what this show is, a conversation with people who kept looking and found something worth sharing. I'm Keats Miles-Wallace. If something in this episode cracked you open a little, pass it on and come back next time. Wonder never stopped. We're just paying attention again.